Well, the NHS is already on a drip, isn't it? And Brexit seems to be cutting that drip. During the referendum campaign at Scientists for EU, we set up a spin-out campaign called Healthier in the EU, because my background is in health research, paired up with Professor Martin McKee, an expert in this area, and we did try to tell them. So I remember we had a letter in the Times, 200 top health professionals saying Brexit should carry a health warning. We put it out there. The Lancet, the British Medical Journal, you know, these leading bastions of thinking about British health were for Remain, saying Brexit could be a disaster for the NHS. We also had, I remember, a survey done on NHS hospital leaders, 75% of whom thought that Brexit was not a good idea for the NHS. And yet, we all know about the bus, and we all know about the tabloid press going on about immigrants straining our NHS. Well, this meant that the public, if you look at polls at the time, more thought that Brexit would be good for the NHS than thought Brexit would be bad for the NHS. So there was a major, major divide between what the experts thought and what the public thought. So what I want to do is go through what the impact has been. I want to talk about the staffing, the finances, the frameworks of collaboration for medicines and treatments, the threat of privatisation, and then I do want to tackle this immigration myth because I think it's very important. Let's start with staffing, because that is key. The data that we get through from staffing in the NHS and the EU citizens staffing our NHS is usually quite a few months behind. But the most recent updates show that after years of growth of NHS staff, of EU staff in our NHS, it is now slowing down and starting to dip, particularly for EU nurses and EU doctors. The only group still growing are the non-clinical support staff. And that comes from the most recent House of Commons Library report. Importantly, most importantly, probably, is EU nurses. Now, if you've heard rumours that EU nurses are leaving because of the English language test, let's deal with that one. EU nurses already in our NHS do not have to do that English language test, and yet their leaving rate has shot up by 67%, unlike UK nurses here or non-EU nurses. If you're thinking about the English language test, you're thinking about recruitment, which has flatlined, thanks in part to this English language test that came in 1 month after Brexit, a very demanding test that is hard even for native English speakers. But that, in combination with Brexit, has caused this 96% fall-off. Really, really not clever. This is why it's not clever, because for years, we had been plugging gaps in our nursing staff with EU nurses coming in. It had been vital. There wasn't growth in UK nurses coming in. There wasn't growth in non-EU nurses. But with EU nurses from December 2013 to December 2016, they more than doubled. They were rising at about 30% per year, and now they're dropping off. This is critical for our NHS because we're about 40,000 nurses short. So from that time period, the total number of nurses in our NHS grew by 19,000. And of that growth, the number of EU nurses in our NHS grew by 21,000. So that means they were plugging the fall and then adding all the growth. So they have been absolutely vital to us. Let's talk about EU doctors as well. Until recently, it looked like the numbers of EU doctors had slowed, but we're still kind of growing. In this most recent House of Commons report, it shows that the peak was hit in March 2017, when 9.9% of our doctors in the NHS came from the EU. In just 6 months since then, it's decreased to 9.6. This is a proportion of total staff. So that growth after years of growth as a proportion is now on the decline. This is worrying. And Wales Online did a Freedom of Information Act and found that for every one doctor coming in, 2 are now leaving in Wales. And why is this? Well, the GMC in February 2017 did a survey of 2,000 doctors, 60% of which said they were considering leaving. Of those that were considering leaving, 91% said that Brexit was a factor. Then, in November 2017, the BMA did a survey of 1,700 EU doctors here in the NHS. 45% said they were considering leaving, 29% said they were still unsure, but overall, 1 in 5, nearly 1 in 5 of EU doctors in our NHS said they had already made plans to leave. So it is turning round. And what are the reasons for them starting to leave? Is it the working conditions of the NHS? You would have thought so. But the top 3 reasons were, 1, the decision of the UK to leave the EU. 2, the attitude of the country to the EU workforce. And 3, the uncertainty about their future. That's all Brexit related. And let's talk about that attitude, because shortly after the referendum debate, the tabloid press went large with EU doctors are less trustworthy than UK doctors. Yep. And so then Jeremy Hunt decided to follow this up and say, oh, that's terrible, we're going to be training more UK doctors. Also, Theresa May chimed in and said, it's okay, the EU doctors can stay here until further numbers of homegrown doctors are trained, implying that these guys are only useful as a sort of temporary stopgap. So that is an attitude that was not lost upon the hard-working staff here that work every day to save our lives. That tone is very important, and that is a major reason, in their own words, why they are leaving. Now, let's talk about finances, as I say in advertising, but wait, there's more. It's not just the staffing. In terms of finances, you all know the message on that big red bus, that we're going to have money for the NHS. No, we're not. There is no Brexit dividend. That supposed dividend amounts to 0.5% of GDP. That is the size of the dividend, that net contribution. Well, we've already burnt up more than that before we've even pulled the plug on the single market. So already we have lost several percent of GDP in growth, and the projections look to be more than 0.5% year on year. This is just basic growth. So you're digging a bigger hole than you can fill with this dividend. And then we're spending money, 3 billion on Brexit preparations. We're spending money on extra civil service. We're spending money on new customs staff. Why? So we can leave the customs union. Is that going to be profitable? No, not by the Treasury's analysis. So we are throwing money away. We are burning it like a bonfire. We have a lot less money for the NHS. And then there's the opportunity cost of our Parliament being blocked up by Brexit proceedings. It means that things that we need to do for the NHS just cannot get through. And then there is the fallen pound. It was estimated immediately after the referendum debate that the fallen pound will add on about 900 million to NHS expenses because it buys so much from overseas. This was followed up recently by an analysis that showed about 3.4 billion's worth of supplies and growing comes from the EU, and our pound is still very low compared to the euro. So that's more money thrown away there. Now let's talk about frameworks of collaboration and what we have thrown away there. The European Medicines Agency, there we go, there's 900 jobs gone just there, with the turnover of over 300 million per year. year gone. That is an earnings of the European Medicines Agency, which was based in London, plus 40,000 business visits per annum gone. Think of all the taxis and the hotels and the restaurants that was bringing in. But it's not just that the European Medicines Agency is leaving the UK, it's also that now it looks like the UK is leaving the framework of the European Medicines Agency, which we used to effectively run. And that means, because we're not going to get that associate status with it, that we are either shadowing the EMA in what it does in terms of regulations to keep in line with that market and making sure that approvals are valid for both, or we do a standalone system, which is the preference of some politicians, but not the preference of anyone in the business. And this is a repeating theme. Back in September 2016, the Association for the British Pharmaceuticals Industry and the Bioindustries Association were saying, we know you want to set up a standalone regulator, don't do that, we won't use it, we won't pay into it, and medicines will get to the UK population slower because you're fragmenting the market. Well, look at where we are with that now. That's just the EMA. There are, of course, other frameworks of collaboration. EHIC, the cross-border healthcare, ECDC for the Centre for Monitoring Diseases across the continent. If we are not aligned with data, if we have data sharing problems, then that cuts us out of key frameworks there. That is important for the NHS too. Now let's also talk about privatisation. Privatisation of NHS England is a real threat. It's what the public don't want, and yet it's what is happening. During the referendum debate, there were those in UKIP and Vote Leave who were saying that TTIP, the Transatlantic Trade and Investment Partnership Agreement between the EU and the US being negotiated, was a threat to the NHS. They were correct. It was. Before we insulated our NHS from it. In fact, other countries around Europe were first to go and insulate their health services from this trade deal. We were one of the last. Why? Because our government wanted to, until overwhelming pressure made sure that they didn't. But by that stage, UKIP and the others were already squealing about it and misinforming. However, should we leave the EU and desperately dive for a trade deal with Donald Trump, what do you think's going to happen? Because we're in a much weaker position there, with naive trade negotiators, with a much smaller leverage with the size of our market, and with a government that actively wants to bring in such big businesses in health provision and health insurance. I think particularly with the Conservative Party, who would these big providers, be funding? Who would they be inviting onto their boards? Once you have companies like that in your system, in your politics, it's very hard to get rid of them. They start dominating the conversation as well and driving privatisation further. This is a big threat coming up. So there are multiple threats to our NHS here. The most urgent ones now are the staffing and the finances that are already hurting our NHS, but coming up quickly down the line are all of these frameworks of collaboration that support our NHS, including, of course, I'm a scientist, research, and the fact that, we have led so many research frameworks across Europe which directly interact with and benefit our NHS and healthcare systems. But beyond that, there's also this threat of privatisation and a UK-US deal, which is very real and which is coming up quite fast. Are we going to be able to see that off if we split from the herd and take it on ourselves? Those are the threats. Now, despite all of that, during the referendum debate, more people than thought that Brexit would be good for the NHS than thought that it would be bad for the NHS. After the vote and the 350 million promise popped, that went to even Stevens, and now it's been opening up the other way. More people think that Brexit is damaging our NHS, which is the correct assessment. However, some still think it's going to be good. There are a few people that think that we are going to economically benefit from Brexit. I think that is dying fast as a vision. But also, there are people who think our NHS is under strain. So when you have immigrants come in, it's common sense that they put more strain on it, so we need to lessen that burden. In the last few minutes, I want to address that myth. I want to talk about, as a scientist, the difference between what people call common sense versus intellectual inquiry. Now, common sense would be that if you have one heavy ball and one smaller ball and you drop them at the same time, then the heavy ball would land first. It's bigger, it's heavier, it's got more force, it drives down faster. Well, one of the very first experiments was Galileo dropping two such balls off the Leaning Tower of Pisa in about 1590, and hey presto, they landed at the same time. Experiment, inquire. Another common sense notion would be that this Earth is flat. You can stand on something flat and not fall off. If the Earth is round, well, you're going to fall off at parts. Everything you can see is flat. But inquiry at the time, seeing ships dip over the horizon or different shadows in different places, they put together the correct notion that the Earth is round. Now, also, for hundreds of thousands of years, we have lived in small tribes, occupying areas with limited resources. So imagine yourself as a Neolithic tribe, you colonize a valley, and then you own the resources, and then another tribe comes in. And you think, my God, they're going to come and eat our berries and hunt our rabbits. And you'd be right, because they would be consuming your limited resources. And we have this trained into us over hundreds of thousands of years, that people come in to take up your resources. So fast forward to the 21st century, and you think, we've got our NHS. Look at the immigrants coming in. They're consuming that limited resource. Is common sense, but it is wrong. And here's why. The NHS has a demand side and a supply side. On the demand side, people use the NHS when they get ill. On the supply side, in comes taxpayer money, and in comes people actually working in it. When immigrants come into the country, they have demand side and supply side. What is the balance of those two that they bring? Particularly with EU immigrants, the demand side is so light. They come in at working age, are happy and healthy, and don't demand NHS in any significant numbers. This has been studied. Sometimes even when they get ill, they go back to their home countries, which are just next door, to get treatment there. And oftentimes they move on. They pay taxes here for years, then move on and go and retire in other countries. Now, on the supply side, we've already seen analyses that immigrants pay in more to the system than they take out in resources. Now, there are some right-wing analyses that dispute that, but they certainly don't dispute that the contribution to cost ratio of immigrants is higher than that of our own natives. They are putting in money. Think of the entrepreneurs generating jobs. The money, not just as individuals, but also those businesses coming in. And then there's the workers in the NHS. Even though EU citizens are 5% of our population, it is 7% of our NHS nurses, 10% of our NHS doctors. They are supply side heavy. They prop up our NHS. The problem is not that immigrants strain our NHS. The problem is that immigrants leaving strains our NHS. And that would seem like a good place to wrap it up then. But these are the messages that we need to get out there, because this is something that people in this country do care about. And You have to go out there with a forgiving attitude and just say, it's fine to experiment, it's fine to have certain ideas, but how do you think it's going now? Clearly it's not going well. Look at where we are now. We need a public vote on the deal that comes back now that we've got clarity about where this is going. And by God, I would say reject that deal. Thank you.